Hey. The topic I am going to discuss is general principles involved in the management of poisoning. Clinical toxicology. Clinical toxicology is the study of the diagnosis, management, and prevention of poisoning and other adverse effects resulting from medications, chemicals, and other substances. It involves the use of laboratory tests and other diagnostic tools to identify and evaluate the severity of toxicity, as well as the development of treatment strategies to manage and prevent further harm. General principles involved in the management of poisoning. First, rapid assessment and stabilization. During the rapid assessment, healthcare providers evaluate the patient's airway, breathing, and circulation. ABCs. Airway. The airway assessment focuses on ensuring that the patient has a clear airway and is able to breathe properly. This includes checking for signs of distress such as cyanosis, blue color to the skin, gurgling sounds, or snoring. If the patient is unconscious or unresponsive, the healthcare provider may need to perform maneuvers such as the head tilt, chin lift, or jaw thrust to open the airway. If the patient is unable to breathe, the healthcare provider may need to provide artificial ventilation with a bag valve mask or a suction device to remove any obstructions. Breathing. The breathing assessment focuses on the patient's rate, depth, and pattern of breathing. The healthcare provider will check for signs of distress such as shortness of breath, wheezing, or cyanosis. The healthcare provider may also use a pulse oximeter to measure the patient's oxygen saturation levels. If the patient is not breathing or is breathing too shallowly, the healthcare provider may need to provide artificial ventilation with a bag valve mask or a suction device to remove any obstructions. Circulation. The circulation assessment focuses on the patient's heart rate, blood pressure, and perfusion, the flow of blood to the body's tissues. The healthcare provider will check for signs of shock such as pale or cool skin, weak pulses, or low blood pressure. If the patient's blood pressure is too low, the healthcare provider may need to administer fluids or medications to raise it. If the patient has a weak pulse or no pulse at all, the healthcare provider may need to start cardiopulmonary resuscitation, CPR. It is important to note that the ABC assessment is performed in sequence, starting with the airway as it is the most critical. If the airway is not open, the patient will not be able to breathe, and if the patient is not breathing, the patient's circulation will be affected and the patient's life is in danger. Second, identification of the substance. If possible, it is important to identify the substance involved in the poisoning, as this will guide the selection of appropriate treatment options. This can be done by obtaining a history from the patient or witnesses, performing a physical examination, or testing the patient's blood or urine. Decontamination. It is the process of removing or neutralizing toxic substances from the patient's body in order to reduce the risk of further harm. It is an important step in the management of poisoning. Inhalation decontamination. If the patient has inhaled a toxic substance, the patient should be moved to an area with fresh air as soon as possible. The patient should remove any clothing that may have been contaminated and should be given oxygen if needed. Gastrointestinal decontamination. It refers to the process of removing toxic substances from the stomach and intestines. This can be done by induction of vomiting, administering activated charcoal, binds to the poison in the stomach and prevents it from being absorbed into the bloodstream, gastric lavage, washing out the stomach with a tube, or whole bowel irrigation. Skin decontamination. In cases where the patient has come into contact with a toxic substance through the skin, the affected area should be washed thoroughly with soap and water. If the substance is not water-soluble, it can be removed by using a dry powder or a neutralizing solution. It's important to note that decontamination should not delay the transport of the patient to a medical facility, and that the effectiveness of decontamination decreases the longer it is delayed. Also, certain substances are not amenable to decontamination, such as corrosives and certain heavy metals, and proper protective measures should be taken by healthcare providers when handling these substances. Poison elimination. When poison enters the bloodstream, Several methods are used to enhance its elimination from the body. These methods helps to reduce the toxicity and adverse effects of the toxic substance by increasing its rate of elimination from the body. Methods such as forced diuresis, hemodialysis, hemoperfusion, and hemofiltration are used to rapidly eliminate the poison. Administration of antidotes. The administration of antidotes is a key component of the management of poisoning. An antidote is a substance that counteracts or neutralizes the effects of a poison. Antidotes work by binding to the poison or by inhibiting its action, thereby reducing the harm caused by the poison. They are most effective when given early in the course of poisoning, and their effectiveness decreases as time passes. Examples: naloxone for opioid overdose, acetylcysteine for paracetamol overdose, and atropine for organophosphate poisoning. Monitoring and supportive care. The patient's vital signs and symptoms should be closely monitored during the course of treatment, and appropriate supportive care measures should be initiated as needed. This may include administering fluids, oxygen therapy, or other medications to manage symptoms such as seizures or respiratory distress. Reporting and documentation. Finally, it is important to report the incident to the appropriate authorities and to document all actions taken in the patient's medical record. This includes documenting the type of poison, the symptoms and signs of poisoning, the treatment provided, and any follow-up care. This information is important for both legal and medical purposes and can help to prevent future incidents of poisoning. Thank you for watching. If you found this video helpful, please give us a like. Subscribe for more videos and also share with all your pharma mates. Thank you.